trusting me in this position. It is a great honor and it is a remarkable privilege to be able to serve the Academy and my fellow family physicians across the state, creating value for this Academy as we serve our patients. I want to tell you a quick story. Just 2 weeks ago, I was lining up for my annual grueling cross-country ski marathon, and I ran across a fellow friend and family physician. It was a chance encounter, maybe lasted 30 seconds, but we ran into each other. We were both trying to get into our gate and get into the space to take off for this 31-mile race. And immediately upon seeing each other, we caught each other's eye, and you can see us both light up. It's been a couple of years since we have connected, and we both understood the situation. We needed to get moving and get on with the whole race and everything else, but we shared a really special bond, this individual and myself, a really rare human experience that about 7 or 8 years before this encounter, we had saved a human life together. And at that time, we shared the relationship of student and teacher. As he was discerning whether or not he wanted to go into family medicine, he was doing a rotation with me in my rural clinic, and we had just talked about the most critical basic things about assessing a patient sick or not sick. Now, what's your first gut instinct? Sick or not sick? Just reviewed this, literally just talked about this. He goes in to see the next patient. He comes flying out of the room, he's like, this one's sick, I think we should go see her together. And he correctly identified that this patient was not doing well. She was in an emergency department the night before and was diagnosed with a gastroenteritis and was sent home. She was not happy about that experience at all. So we assessed this patient and we very quickly realized this is probably an atypical presentation of an acute myocardial infarction. And this patient has zero awareness at all of the gravity of the mortal situation that she's in. And she's also really pissed about her experience the day before in the ER. And so she has nothing to want to go back to the ER. And we had talked with her with logic. We had used a couple different strategies to approach her differently as far as, this is something we really need you to do. And in a state of a little bit of desperation, I felt there was a moral obligation, because she did not understand the gravity of the situation, that I could not even entertain some kind of AMA or against medical advice. She didn't understand the peril she was in. Clearly she was scared that there was something going on. And so I took an approach that I had never taken with a patient before, very much out of my character, to get clarity of roles of who we are in this situation, patient, doctor. This is what you're going to do next, and this is what you can expect as we are attempting to save your life. And she complied and went to the ER. And my medical student tagged along with her for the continuity of the experience, and she had a STEMI. So she was helicoptered from our critical access hospital off to go to surgery. And why do I bring this up? Because it is really hard to understand what we do day to day. We talk about scope of practice, and that's kind of like the best space we can get into it with the public and with hospital administrators and with even our patients and our families. And we attend and observe human birth, the joys and tragedies. We attend and observe people's transition into death, the joys and the tragedies. We deliver in every aspect of healthcare delivery. There are all of you there. Every aspect of healthcare delivery, family medicine touches. And we struggle to communicate this to the public and to our legislators and to people. We can specialize into some kind of niche innovation or some kind of content we really love because we're impassioned by it. And we can also specialize in being the true generalist. From patient bedside to boardroom, we're everywhere. Family medicine, doing our job, serving our people, taking care of our patients. But the thing that we don't talk about enough, talk about the scope of practice. What about the depth of our human experience as family physicians taking care of those patients? And that's something that's really special, that is virtually invisible to the public. It is virtually invisible to hospital leadership. It's sometimes invisible to our closest family members and relatives. How can you understand that I just shared in a tragedy in this patient room, and I'm gonna knock on the next door and get my smile on my face because I attended this delivery last week and this mom is so excited to finally have a baby that they've been trying to have for years. And the space where we get to share that, the space where we get to be seen, is here at our academy. We as professionals can get together, see each other, share our stories, share our joys, share our concerns, collaborate to provide value to our patients and to ourselves, conspire about the future, understand where the breakdown in the fragmented healthcare system is, figure out solutions and a strategic plan for how we can deliver for the next generation of family physicians to come in and do this work and take up this mantle. At our academy, you are seen, you're respected, you're celebrated. And this is why we come to these spaces, to be able to see each other and do these things. So back to my story, in that brief moment of 30 seconds, no more than that, all this flashed through my mind. And I saw him, and he saw me, and we immediately had mutual respect for each other and mutual admiration for each other because we knew what we both do as a craft, the stories we wear. I remember when he was a student, he said he wanted to do a burpee. And at that time he hadn't, but it crossed my eye that he had a number 3 on his bid. Man, the years have passed too quickly. He's already done 3 of them. Here we go, let's line up. We'll see you at the end of the race. And let's find a time to connect after this is done so that we can catch up, because it's been too long. So with that, thank you for allowing me the privilege of being the president of the Wisconsin Academy of Family Physicians. I look forward to collaborating and conspiring with all of you as we go forward. And if you're looking for a kindred spirit or 20, come to one of our meetings because you'll find your home.